All right, welcome back, everybody. We've got some new fallout today over the latest report of some fuzzy math inside the healthcare overhaul. The latest report reveals that older adults who have jobs will end up paying more for their healthcare coverage than those who don't have jobs. Pennsylvania Congressman Tim Murphy, co-chair of the House GOP Doctors Caucus, joins me now. Congressman, welcome. Good to have you here.
Great to be with you.
How did this happen, and what do you make of it?
Well, it's an amazing thing what happens when you don't get a chance to read a bill or you have to pass it to find out what's really in it. Basically, it works out this way. Someone can retire at age 62, and someone else may decide to work. The person age 62 starts to get some Social Security income. And so you can have two people or two couples making exactly the same amount of money. But if you're getting Social Security income, $1,000 of that isn't taxed or isn't counted as your income. So it actually, on the books, looks like you're making less than you are. And then you qualify for Medicaid. Medicaid's supposed to be there for really needy families or those who are disabled, not for middle class. And it is a big glitch and a big problem, and it makes a lot of people think, why keep working? Why continue to pay taxes and go into the system? And it's a problem that has to be solved.
Yeah, you know, I spoke to a couple of people about this yesterday, one of whom is a supporter of this health care reform plan, and he said, look, you know what, this doesn't affect a lot of people. And it's a small, price to pay, and it will get figured out when you're talking about covering 30 million people who didn't have health care coverage beforehand.
Well, it is a bigger problem than that, because you also have people, as it turns out, that anybody with incomes, a family of four, who makes under $88,000 will get some additional coverage another way. By the way, that includes every state senator and state representative and their income except in California, where they get more money.
Really?
That's an interesting concept. Yes, California, they make $113,000 a year. But isn't that interesting? They're all going to get supplemental assistance here.
So wait, you're saying that back up. I just want to go over that point one more time. So you're saying that there are congressmen and congresswomen across the country who will qualify for Medicaid?
They'll qualify other assistance under the new health care bill, not necessarily Medicaid, but other income assistance. And that's why you're going to see a lot of employers say, you know what, I'm throwing up my hands. When people talk about 35 more million Americans being covered, they estimate only 9 million would lose their coverage from their employer. Estimates are now saying maybe 50 or 60 or as high as 80 million that would lose their coverage. Because after all, if you're an employer and you say, do I cover my employees with $10,000 for an employee, or do I pay a $2,000 fine and walk away? And a lot of them are just going to walk away.
Yeah, and that's the easy part of the math that was discussed in great detail before this was pushed through Congress. And that may be the reality as we look at it. Congressman, thank you very much.
You bet. Thank you.
Lots to still think about in digging this health care reform bill. Thank you very much, sir.